more likely to be called ADHD, often fidgets or squirms, often has to get up from their seat, often runs or climbs when he shouldn't, often has difficulty with quiet leisure activities, often on the go as if driven by a motor, often talks excessively, often blurts out answers before questions have even been completed, often has difficulty waiting his turn, and often interrupts or intrudes on other. It's almost like their personal space is a little bit different to the normal person. So as we said, if you're going to have the combined type, you don't just need a mixture of 6 of these, you need 6 in each of these categories. Now the next key part of this classification system is something that also tends to get ignored when we're talking about this, particularly when you're reading just the popular magazines. Now these symptoms must be present in 2 or more settings. So a warning sign for some parents when they're being perhaps coaxed or suggested that they should get into this diagnosis is, number one, if your child is the perfect child at home but your teacher is complaining about the behaviour of your child in school, then unless there's another setting where your child is getting the same feedback, it may be an issue that you're needing to look at what's happening at school more than what's happening in their brain, so to speak. Or if it's the flip side, if you're having incredible problems at home and yet the teacher says he's the best kid in the class, you know, then you're probably looking at something else that's going on. This needs to be present in just about every environment this child's being involved with. And this individual, it must show clinically significant impairment. So it's not just something that's, you know, well, it's a bit annoying, you know, sometimes it's really frustrating and, you know, it makes it embarrassing at times. This needs to be clinically significant. So, you know, when you see the classical kids with this, you know, you really see that it's affecting them and it's affecting the people around them. And another key thing is the individual must not suffer another mental disorder that could explain the symptoms. And I've seen this more and more lately where people, for example, the last time we did this workshop, some parents brought their child because they weren't able to get a babysitter because of this child's behaviour. But it was very obvious to me that the kid had more deep-seated, you know, not psychological but psychiatric and almost you know, genetic problems as well. And to then classify that child with ADHD is a little bit unfair. It's almost like giving them an additional diagnosis over and above what they really need. So if there are deeper psychological and psychiatric stuff going on, then to also give them the label of ADHD. We see this a lot with kids with Asperger's where they're said to have Asperger's and ADHD. Like, to me, they've either got one or the other, and let's decide, you know, which one it is. So how easy can you catch it? Because it seems to have become easier to get it. And this is what the experts say. ADD and ADHD have become fad diagnoses and are therefore easily diagnosed. And what we're seeing more and more is people who are reading magazines, they're starting to diagnose it. Teachers are suggesting to parents that maybe their children have it. People are going to their GP and just describing the symptoms of their child, and the GP saying, well, maybe they've got it. So it's like a lot of illnesses that once people know they're out there, then they seem to be, everyone else seems to get them. As I said, I was convinced for a little while that I probably had it. So as we said, we do need to rule out other underlying mental and emotional issues. So if there is histories of physical and or sexual abuse, family violence, tension, depression and stress, even autism, as we said before, it needs to be differentiated, you know, what sort of area this child is really and then we've got bipolar disorder, which is manic depression. You know, we've got kids who are running from one extreme to the other. So is it really important that you do look at this child from a lot of different angles so that you can rule out some of these things? Because if you have a child who's particularly in those first 3 categories and then you just decide to medicate them, then you're really just pushing the real issues beneath the surface. You know, maybe you need Dr Phil to come in and I've been watching Dr Phil lately and, you know, he tells it how it is, you know, he tells you to get your life sorted out. But maybe that's what needs to be done, is this child needs to be counselled, the family needs to be counselled. There needs to be some processes put in place, you know, apart from just Band-Aid treatment. So there are some other ways of testing for some of the attributes of an ADHD person. As we mentioned before, there is the genetic trait, so you can actually test for the genetic trait. You can actually take a swab of the cells on the inside of your mouth, and they can be tested to see whether you actually have that genetic variation. So I guess if someone was really debating about this diagnosis, then this may be one way to go. We know that from EEG tests, electroencephalography, which is like measuring the brain waves of your brain, there's different brain wave patterns, and ADHD people do tend to show very characteristic brain wave patterns. So that's one way of picking it up. And then there's things like SPECT scans and PET scans, which are they're scans that look at the activity that's going on inside of your brain. That's what we've got flashing up there on the screen at the moment. We see a normal brain. This is probably an ADHD kid, and this is someone with chronic drug abuse. So you can see how the brain's working very differently in terms of the activity areas and the damaged areas almost. So you can look at getting into these if you're wanting more information just than the checklist and the medical and pathological tests. Then this is some ways that you can get more information about the way your child's brain's working and their body's working. So next golden rule number 1, which I like to pass on to you, how thoroughly has your child been assessed? If you are finding that the diagnosis has come from your teacher or from your GP or from yourself, then you need to be looking at more avenues, whether it's a psychologist or a paediatrician, whether it is calling someone in through the school that's going to assess your child properly. It does need to be multifaceted. So as we said, how do we diagnose it? We need medical tests. We talked about the thyroid before. Educational evaluation. They need to be properly evaluated in the educational setting. Behavioural history, we need to look at, what's the history of this child as an infant, as a toddler, when they're at preschool, when they're at kindergarten. Not just what are they doing at the moment, but what have they been doing throughout their life history. And then obviously you need to check their vision and their hearing. There may be some just really basic stuff going on that may not be assessed if you overlook these things. And developmental illnesses, a child who is developing illnesses could be having behavioural changes occurring at the same time. So now let's look at some of the conventional treatments that are around, that's available to a person who's now accepted the diagnosis of ADHD. The real cornerstone of conventional management is what we call behaviour management techniques, and the cornerstones of that, the foundations, is consistency and positive reinforcement. They're the keys in terms of behavioural stuff. Appropriate educational program within regular classroom and special ed. We're a little bit lucky in Victoria that you can get special ed teachers sometimes if you're lucky. And counselling may be important. It's something that, as a culture, Australians tend to be a little bit funny. When you listen to Americans, they all seem to have their analyst or something. But as a community, we probably don't tap into counsellors and family therapists and psychologists and things like that, particularly with these sorts of issues, perhaps as much as we could do. And then obviously medication is a key foundation too of the way that these problems are conventionally treated. And the main ones we're talking about are the psychostimulants. Some antidepressants are also used, and they even actually use some antihypertensives because they found that these affect the circulation of the brain and can sometimes change behaviour as well. So let's explore the drug option a little bit, because this is really the dominant behaviour, I guess, in our community at the moment in terms of managing ADHD, ADD, Asperger's, oppositional disorder, all of these same sorts of similar kind of varieties of similar problems. As we said, psychostimulants are the most commonly used, and the way these are thought to work is that they believe that they change the levels of the neurotransmitters in the brain. So remember how we talked about that brain reward cascade? The idea is with these is that this child is